Hello, my name is Nathan Lee and I am in 7th grade, attending Northbridge Middle School. My instructors for this project were Dr. Lewis Lee of the UA School of Social Work and Mr. Brighton Cherry, faculty at Northbridge Middle School. Getting started, my STEM Showcase project focuses on the social sciences, and the title is Pets and Older Adults' Mental Health During COVID-19. Providing background, throughout COVID-19, numerous studies have reported the negative effects of social isolation on mental health among the general population, and particularly among older adults, due to their physical and mental vulnerabilities. In one study conducted in China, for example, more than one-third of older adults reported depression and anxiety since the beginning of COVID-19. Similarly, a national survey study in China showed older adults were more likely to show signs of anxiety and depression than younger people. Social isolation due to COVID-19 contributes to the poor mental health outcome among older adults, such as high levels of depression and anxiety. Many older adults experience lower social connectedness through smartphones and social networking than younger people, as they are not as comfortable with modern technologies. Therefore, we need to pay extra attention to older adults' mental health during COVID-19 and find effective methods to support their mental health. In Alabama, many of our older adults live in rural, lower-income communities and lack many resources essential during a pandemic, including reliable internet service. Therefore, social connectedness via the internet is not always available. Considering these barriers, we need to find strategies not necessarily dependent on the use of technology, and companionship provided by pets can be a possible method. Almost 57% of U.S. households had at least one pet as of 2016, and animal adoption rate has dramatically increased during COVID-19. Therefore, the purpose of this project is to examine the impact of having pets or companion animals on older adults' mental health by reviewing existing research studies. And the hypothesis is that keeping pets or companion animals will reduce negative mental health outcomes among older adults. The materials used for this project were a computer and internet-based academic database search site, PubMed.gov. PubMed is a search engine for scientific research studies run by the National Institute of Health and trusted by researchers for the valid evidence of its studies. Most importantly, it is open to the public, a student like me, included at no cost. Moving on to our procedures, the first step was that in order to simplify the search process, I chose keywords that represented my hypothesis to search for peer-reviewed research studies, specifically older adult, pet or companion animal, and mental health. The second step was that using the advanced search menu in PubMed, I searched for articles that featured my three keywords in their title or abstract. Moving on to the results, I found 6 research studies that met the search criteria. However, 3 articles were excluded as they did not examine the impact of pets on mental health. The remaining 3 articles all demonstrated the positive impact of pets on the mental health of older adults. One systematic literature review reported findings from 52 previous studies that showed improved quality of life and reduced anxiety, depression, cognitive impairment, or behavioral or psychiatric symptoms of dementia in older pet owners. Another article was a survey study of 830 pet owners aged 60 or older and found older adults who owned pets were less lonely than those who didn't. The final article was a review of existing knowledge about the benefits of having pet dogs, including increased awareness of one's own well-being and decreased anxiety and aggression among dementia patients. My research showed that pets and companion animals have a positive impact on many aspects of older adults' mental health. Therefore, it would benefit many socially isolated older adults in this COVID-19 era if our community could provide them with opportunities that involve companion animals. However, we also need to consider the physical burden having a pet may add to their daily lives. Therefore, it would be helpful if we provide older adults with assistance to take care of their pets. Finally, future research should examine other factors such as income that may impact the relationship between pets and mental health. Below are the articles used for the research of this project. Thank you for